Our group will explain to the topic adrenergic receptor antagonists. There are four type of antagonists, which are alpha blockers, beta blockers, mixed sympatholytics, and centrally acting. We will explain further for the example of the drugs and the mechanism of action of the drugs and the pharmacokinetics of the drugs, indication and the side effect of the drugs.
Alpha blocker agents. The example are parazosin, dosazosin, and terazosin. The mechanism of actions is selectively inhibits alpha-1 adrenergic receptor. Blockage of alpha-1 adrenergic actions on the vascular smooth muscle leads to a decrease in vascular resistance and anti-hyperactive activity. The pharmacokinetic of alpha blockers agents. Absorptions. The absolute bioavailability of clonidine on oral administration is 70% to 80%. Distribution. Following intravenous administration, clonidine display biphasic dispositions with a distribution half-life of about 20 minutes and an elimination half-life ranging from 12 to 16 hours. The antihypertensive effect is reached at plasma concentration between about 0.2 and 2.0 nanogram per milliliter in patients with normal excretory function. Metabolism. About 50% of the absorbed dose is metabolized in the liver. Elimination. Following oral administration, about 40 to 60% of the absorbed dose is recovered in the urine as unchanged drug in 24 hours. The half-life increased up to 41 hours in patients with severe impairment of renal function. The indication of alpha blockers agent is benign hypostatic hyperplasia. The adverse effect is reflex tachycardia and nasal congestion.
Next, I want to explain about beta blocker. The examples of beta blocker are propranolol, atenolol, metoprolol, and pindalol. The mechanism of action for this blocker are beta-2 receptors blocked by beta blocker when the smooth muscle presynaptic sympathetic neurons send impulse to the cardiac tissue. This will cause reduction of heart rate and force of constriction, and this will cause reduction of cardiac output, so blood pressure will reduce. In pharmacokinetic, the absorptions are many beta blockers undergo first-pass metabolism upon ingestion. For distribution, metoprolol and propranolol can cross the blood-brain barrier, so they can produce CNS effect in overdose. Atenolol dose does not cross blood-brain barrier, so less chances of CNS effects. For metabolism, majority of beta blockers are metabolized in the liver. As mentioned before, many beta blockers undergo first-pass metabolism. Finally, for excretion, majority of beta blockers are excreted into the urine. For contraindications, the examples of contraindications are systolic heart failure, arterial fibrillation rate control, post-myocardial infarction, angina pectoris, migraine, and hyperthyroidism. Finally, for side effects, bradycardia and increases TPR.
Next, for the mixed sympatholytic. The examples are the labetalol, carvedilol, and nebivolol. It's true, the blockage of both alpha receptor and beta receptor. The blockage of the alpha receptor will result primarily in the dilatation of the vascular tissue, while the blockage of the beta receptor will the major pharmacologic targets being the heart and the vascular smooth muscle. Propranolol will block beta-1 and beta-2 receptor, while the atenolol and the metoprolol block mainly the beta-1 receptor. For the pharmacokinetic, they are readily absorbed after oral administration. They are lipid soluble, undergoes considerable hepatic first-pass metabolism, and has an absolute bioavailability of approximately 25%. Following the intravenous infusion of the labetalol, the elimination half-life is about 5.5 hours, and the total body clearance is approximately 33 mm per minute per kilogram. The plasma half-life of the labetalol following an oral administration is about 6 to 8 hours. Metabolism of the myxin-batolytic mainly through the conjugation to glucuronide metabolites. They are excreted in the urine and via the bowel into the feces. Approximately 55% to 60% of a dose appears in the urine as conjugate or unchanged labetalol within the first 24 hours of dosing. It is indicated in orthostatic hypotension and dizziness, and it brings the side effects such as the congestive heart failure and also the left ventricular dysfunction.
And now I will explain about the centrally acting of adrenergic antagonists. The example of centrally acting is clonidine methyl-dopa, and for its mechanism, it will block sympathetic activity by binding to and activating alpha-2 adrenal receptors. This reduces sympathetic outflow to the heart, thereby decreasing cardiac output by decreasing heart rate and contractility. Reduce sympathetic output to the vasculature, decrease sympathetic vascular tone, which causes vasodilation, and reduce systemic vascular resistance, which will decrease arterial pressures. For its pharmacokinetics absorption, the absolute bioavailability of clonidine and oral administrations is 70% to 80%. While for its distribution following intravenous administrations, clonidine displays biphasic dispositions with a distribution half-life of about 20 minutes and an elimination half-life ranging from 12 to 16 hours. The antihypertensive effect is reached at plasma concentration between about 0.2 and 2 mg per ml in patients with normal excretory functions. For the metabolism, is about 50% of the absorbed dose is metabolized in the liver, while for elimination following oral administrations, about 40% to 60% of the absorbed dose is recovered in the urine as unchanged drug in 24 hours. The half-life increased up to 41 hours in patients with severe impairment of renal functions. For the indications of central acting, is used for attention deficit hyperactivity disorder, which is ADHD, and anxiety and also stroke patients. For the side effect of central acting is sedation, tetagry, and also xerostomia. Thank you.